Hi everyone, welcome to the community classroom. This is Dr. Tracey McCarthy, psychologist, attorney, and educator. ADHD and bipolar disorder are distinct psychological challenges, but I cannot tell you how many times these issues get conflated in clinical practice. This conflation is no small issue because the way that a set of symptoms is understood dictates the considerations for intervention. In other words, how we categorize something determines how we respond to it. And so, given that the interventions for these two disorders often involve some form of medication management, it is imperative that individuals and clinicians are clear about how the symptoms should be characterized. Without this differential diagnostic process, countless individuals with neurodevelopmental disorders will be prescribed mood stabilizers, while those with emotional dysregulation symptoms that involve mania will be given psychostimulant medications. So let's look at the 4 diagnostic factors that separate ADHD from bipolar disorder. To begin, and most important, bipolar disorder is rare in children prior to adolescence. This is one of the reasons why it was so helpful to previously require the manifestation of ADHD symptoms prior to age 7. Now the manifestation time frame for both ADHD and bipolar are seen as coming during the same developmental period of adolescence. So we now have to look even more carefully at just when the symptoms emerged and also how they present and persist over time. Okay, so now we're going to look at the 4 factors that separate these two disorders. Number 1, individuals with bipolar disorder may have increased activity, poor concentration, and increased impulsivity. But these features are episodic in bipolar disorder. They may occur several days at a time. When we're talking about ADHD, however, we're talking about something that is persisting over time. It's not episodic, it's not cyclical, it's pretty consistent and persistent. So the child would be experiencing these symptoms, or the adult would be experiencing these symptoms pretty much every day versus in a cycle. Number 2, in bipolar disorder, increased impulsivity or inattention is accompanied by an elevated mood, or you might see grandiosity. This is not the case with ADHD. There is no necessary mood fluctuation that goes along with the increased activity, the poor concentration, the inattention issues. So those two don't go together in ADHD. You don't have to have this, dysregulated mood dynamic in ADHD like you need to have with bipolar disorder. And number 3, children with ADHD may show significant changes in mood within the same day. Okay, this is distinct, however, from a manic episode, which must last 4 or more days to be clinically significant of bipolar disorder, even if we're talking about children. And last but not least is what I brought up before, is that bipolar disorder is pretty rare in pre-adolescence. However, ADHD is common in pre-adolescence. Okay, so this very concisely delineates the diagnostic dynamics surrounding the distinctions between ADHD and bipolar disorder manic symptoms. We hope this information is helpful, and we welcome comments and questions in the comments section. Remember, knowledge is power. See you soon.